100 miles away, and he returned to duty, transmitting COVID-19 to the inmates, and 35 of them contracted COVID-19, 7 died. These 7 never attended the wedding party. They had been isolating peacefully at their nursing home. Within a month, they had lost their lives in circumstances they could never have imagined. This is a clear pointer to how important it is for us to take responsibility for ourselves as individuals and for our families and communities. Let us know, therefore, that when you obey non-pharmaceutical recommendations, you protect yourself and others. This remains, at present, the best way to defeat this pandemic. Thank you all for your attention.
Chairman, sir, honorable ministers, PAMSECs, ladies and gentlemen, I'm really going to talk on the trending issues in terms of the election and then school reopening. So as we are aware, the governorship election is holding in Edo State this weekend, but the pandemic still poses an additional challenge. A few months ago, we developed the guideline conducting election during the COVID-19 outbreak in Nigeria, and this guideline is actually for the political parties, the electorates, the election monitors, INEC, and other relevant stakeholders. And it actually provides recommendations and actions that should be taken to reduce the risk of exposure to COVID-19 during the election. The virus thrives in mass gathering, and during the election, we are expecting a lot of people. And where there's lack of adherence to public health measures, in non-pharmaceutical measures, there's a possibility of us spreading. We just got a story of someone that went somewhere, but a secondary infection, and of course, causing death to the vulnerable. And we need to avoid that. So mass gathering during election will likely occur, and the only way to conduct election without putting anyone at risk of contracting the COVID-19 is to comply with the protective measures at all times. And so we recommend the following: ensuring hand hygiene and temperature checks at the campaign grounds, polling stations, providing additional polling stations or booths to ensure physical distancing can be maintained with clearly marked floors and demarcation to enforce 2 meters spacing on queues, mandating the use of face masks for everyone, regular cleaning of polling stations, tables, and other surfaces. Those are areas that is easy to contract the virus. Multiple hand washing points or alcohol-based hand sanitizer should be provided. All staff at the polling units should practice hand hygiene frequently. Of course, when we meet with people, we need to do that regularly. So these are actually a few recommendations, and we hope that the election will go well. We know INEC has put a lot in place, and we're also employing our people to please adhere to those non-pharmaceutical measures so that we don't take home the virus to our loved ones, especially our vulnerable ones. Now I'm going to go into the school opening. States are agitating, they want to open schools, but we have continued to educate the public on measures to reduce the risk of transmission of COVID, and we will continue to review the situations in other countries that have reopened schools, as well as guidance from WHO and other public health authorities. If school carefully coordinates, plan, and put the required safety measures in place before reopening, there is lesser risk of COVID infection in the school setup. We're actually working closely with the Ministry of Education, the PTF, the states, and other stakeholders to ensure that the required safety measures are in place to mitigate the impact of the pandemic in schools. The PTF and the Federal Ministry of Health have mandated schools to conduct periodic weekly risk assessments, while the states and the local government to conduct monthly and quarterly risk assessments, respectively. This will actually help to promptly address the gaps that may exist in reducing the risk of COVID and spread in the school. Beyond this, the LG and the states have been advised to set up multi-sectoral school health committee dedicated to supporting and monitoring the implementation of school protocols and safety protocols in schools. Safe school reopening requires collective efforts, and that includes the parents, the teachers, the school authorities, the communities, the civil society organizations, the media. The government cannot do it alone. Thank you.
The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So we are quite aware of the numerous concerns that have arisen from our rollout of the international travel and testing protocol. Testing and self-isolation remain very crucial scientific approaches that the PTF is using to mitigate the spread of coronavirus in Nigeria. We continue to work tirelessly with foreign governments to ensure that the entire entry process into the country is seamless, it's safe, and it's also sustainable. So with that in mind, we know that various countries have different approaches to testing, and a good number of them charge for PCR tests. The PCR tests that we do in country for public health purposes remain free and can be accessed by any person within a government medical center. Travel-related costs will be charged because they are personal costs that at the moment will be a risk to our public health response if they were to be made free. The private sector has been supporting our efforts with the testing of international travelers in order to meet the growing demand and to make the testing more efficient. Other countries, both in Africa, in Asia, and even in Europe, are implementing similar protocols. Currently, about 5,000 air travelers come in and out of Nigeria. And the PTF wants to ensure that we do not lose the gains made in the response. It is therefore critical that passengers get tested and follow protocols correctly. When fully open, the number of passengers going through the country is not small. At the moment, our daily testing numbers is about 2,500 a day. If we add the passenger numbers coming, potentially we are tripling the number of tests we do every day. And that's why we have to use the private sector to get this leverage, while at the same time working to bring down the cost for passengers. Therefore, it will be costly and unrealistic for the federal government to bear the cost of a test for each passenger coming into Nigeria. This will not only be unsustainable, but will also redirect precious resources away from the public health response. I'm pleased to say that the private laboratories that are now on the platform have resolved issues around registration and generating of the QR code. However, the PTF will continue to monitor and mitigate issues as they arise. So why is it important to test before and after arrival to Nigeria? Testing pre-boarding provides assurance to passengers that are within the same cabin that the persons you are sitting with are non-infectious at the time. And that's why we want the test to be done as close as possible to the time of departure. As close as possible to the time of departure. However, we have provided a validity for the PCR test to be presented to have a validity of 96 hours, in other words, up to 4 days, in order to cater for those that might have difficulty getting a PCR test done quickly in other parts of the world. We have realized that this is causing tremendous difficulty for some passengers in some countries that have long turnaround times. And for this reason, the PTF has agreed, and in line with the draft West Africa Health Organization guidelines, to extend the period of validity for the COVID PCR test that passengers need to board when coming into Nigeria from 96 hours to 120 hours. Nevertheless, we still continue to strongly recommend that tests be done as close as possible to the time of departure, because this is what will reflect the person's true infectious status, not only in the plane, but also at the point of arrival in Nigeria. We will continue to do testing at day 7 after arrival. When you arrive in the country, you will present your QR code, which is the barcode, which can only be generated if you have gone online to the portal and you have filled your health questionnaire, and you have also uploaded your COVID-19 negative PCR result. The QR code can be generated even if you are having difficulty paying. We expect even diplomats to go online, use the portal to register and fill the health questionnaires, and also upload their COVID-19 PCR results. Because if they subsequently turn out to be positive on testing, we need to be able to get back to our electronic systems and have a look at the results to make sure that the passenger did have a genuine result. It's also faster for the passenger if they have their health questionnaires filled before boarding, and it's electronic, because the system for clearing at the airport is very quick. While we continue to have issues with payment, we will not insist on evidence of payment before boarding, but we will be releasing a strong recommendation to airlines that preferably people come on board with a QR code. It will be a strong recommendation, but will not preclude boarding. We are urging passengers coming into the country to make sure they pay for their COVID-19 PCR test by day 7 of arrival. If passengers do not have a test for COVID-19 by day 14, our system will pick up those passengers, and if it is very clear they haven't had a test for COVID-19, their passports will be suspended for a period of 6 months. Therefore, it's really essential for non-Nigerians. Their visas on their way out of the country will be cancelled, so they might have difficulty coming into the country. It's very important we keep to this protocol because it's a protocol that's been designed to ensure safe opening of our airports, and it's the only way that we can quickly open up our airports without further delay, allowing passengers to come in. In terms of numbers, from May till August 2020, we've undertaken evacuation and emergency flights into the country. There have been, in one instance, in several, well, not even one instance, there have been instances where passengers have left with COVID-19 PCR results that were negative, and on arrival, at the time when we used to test within a day or two of arrival, having positive results. In fact, of the passengers that came into the country, and we had more than 14,000 evacuated, on average, about 5% of them tested positive for COVID-19, even though they had a negative PCR on boarding. We have identified 13 countries that had significant discrepant COVID-19 test results, of which 9 had a significant percentage that were discrepant, that we couldn't explain by just the incubation period. We are working closely with these countries to rectify the matter. We have met with their ambassadors, and we have also obtained additional information on the sort of testing that they do, and also assurance from these countries together with a list of accredited laboratories that we can use. One of the reasons where you can have a discrepant result is if somebody uses an antigen-based test, which is less sensitive than a PCR, and boards the flight. If they do have COVID, antigen-based test kits can miss as much as 4 out of every 10 confirmed PCR positives. So to enable early detection and to reduce the risk of further transmission based on the data and our current laboratory capacity, all incoming travelers must be tested by a certified private laboratory after 7 days of returning to the country. And there are only 3 criteria for these private laboratories to get onto the portal. Only 3. 1, they have to be licensed through the Medical Laboratory Science Council of Nigeria. 2, they must have undergone a process of validation and optimization by NCDC. And then thirdly, they must be accredited by the state governments because their results will feed into the state numbers. We have already reached out to at least 9 states, urging them to work with the private laboratories within their areas and come up with a list of accredited laboratories that satisfy this requirement. And these laboratories will go onto the portal. At the moment, we only have portals for Lagos and Abuja, but we have arrangements with the laboratories serving these areas to be responsible for collecting samples for passengers outside Lagos and Abuja. We're working very hard to open up more private laboratories across the rest of the country. And we believe that as more laboratories get registered and come onto the portal, the easier it will be to continue to push down the cost of a PCR test. In terms of self-isolation, all inbound travelers have a responsibility to self-isolate for at least 8 days. You test at day 7. You exit isolation at day 8 if you are negative for COVID-19. And we will also urge members of the community to help to enforce and police this, because this is all about being the Good Samaritan. Other countries in other parts of the world, that's how they enforce their self-isolation. In fact, self-isolation is by far the most important tool in preventing transmission of COVID-19. In terms of exclusions to the portal, I'm pleased to inform you that in line with international protocols, we have excluded children below the age of 10 years. They do not need to have a COVID-19 test in Nigeria. They do not need to be paid, they don't need to be charged, but we would still request that their health questionnaires and their negative COVID-19 PCR results when they are boarding, where available, should be included. The same applies to the diplomats. We would expect them to fill the health questionnaire and also to upload their COVID-19 PCR results. Finally, it is important that we continue to remain vigilant. It is important that we continue to understand that while we open up international travel, we are yet to flatten the curve. And we really need to continue to keep our eyes on the ball. By opening up our airports, there's no doubt that there's that risk of possible importation, and we have to do whatever we can to mitigate this risk. We cannot risk a new wave of infections that will be a detriment to the lives of our country, men and women, and as well as our economy. Finally, the PTF is working with NCDC, the Federal Ministry of Health, and the Federal Ministry of Foreign Affairs to provide guidance to travelers, advisories in terms of travel to high incidence countries. And this will be updated regularly, similar to what happens in other parts of the world, so that Nigerians will be informed of the risks so that they can avoid non-essential travel. Thank you.
Thank you, National Coordinator. I now call on the DG, NCAA, to update us.
The Chair, PTF, Honorable Ministers, ladies and gentlemen, good evening. Most of my brief has been done by the National Coordinator. Basically, the issues we've had over the last 1 week for the international passengers coming in had to do with the online platform where you fill in all the information, upload your PCR negative test, and pay for the second test in Nigeria. I'm glad to report most of these problems, technical issues have been resolved. So we'll be releasing information to the industry and the traveling passengers late today on the use of the platform. It's strongly recommended to use the platform to make your payments, fill in all the necessary forms, and upload your pre-arrival negative PCR test. That will save you a lot of time when you arrive in either Lagos or Abuja, because if you don't do that, you have to fill the forms manually. You have options to go pay for the PCR test. That could add another 1 or 2 hours to your processing time at the airport. So all passengers are strongly recommended to use that online platform for ease of the airport processes. You don't want to be delayed after a long flight at the airport. The other major thing is most of the airlines are demanding for more flights. But as we're all aware, we have a restriction on the number of passengers we allow in Delhi, but working with the National Coordinator as things stabilize, will gradually increase the number of passengers allowed to each airport on a daily basis. Apart from that, I don't have much on the aviation side. Thank you.
Thank you very much. That rounds up the update session. Now we can take your questions. Are we ready? Okay.
The Chairman, National Coordinator, members of the PTF, my colleagues, my name is Amaka Odea. I report for Arise News. And my first question is for the Honorable Minister of Health. Well, it has to do with the fact that we're seeing more states announce date for reopening of schools. And of course, one of their mandatory protocols is that children are supposed to wear face masks. But we need clarifications, especially for those who have children who are below the age of 5. Are they expected to wear a face mask when they resume schools? We need a clarification from you or the NCDC representative. And still staying with you, Minister of Health. Well, since that signing of that MOU, that Memorandum of Understanding with Russia in terms of their vaccine, Nigerians need more, information concerning that, because I remember that there was a clarification that came that said, we don't have the vaccine in country, even though there was a statement from your office that said, you know what, you had recommended to the bodies in charge of, going through the research and all of that. So we want to know really, that Memorandum of Understanding, what does it entail? We need more details on that. And finally, to the National Coordinator, Dr. Sani Aliyu. It still has to do with students going back to school, especially for tertiary institutions. Most of them are being asked to pay for tests. And I'm asking, since you've actually reiterated the fact that in country you can test and it's free, parents are still being asked to pay in specific schools. Why is this so? And what is the PTF's recommendation concerning this issue? Thank you.
Good evening, honorable ministers and my colleagues. My name is Friday Okrigbe. I'm a reporter with Channels TV. I have two questions. I would like to direct the first to the national coordinator. Apart from the 5% of the evacuees that tested positive, even though they tested negative before they boarded, we have some concerns during the week that we have international travelers who are coming in of recent that are coming in with fake PCR tests. This concern actually came up from some health workers. And so the question is, how is the PTF actually managing or handling such situation? Those who come in with fake PCR tests, how we handle them? Then the second question, I would like the DG NCAA to respond to that. It's a clarification. Before we lifted the ban on international flight, there were countries that were mentioned that it appears we do not want people to travel from those countries. Now, what I want you to explain is if that ban was on citizens from those countries or flights operating from those countries. The reason I'm asking this is during the week also, there was a discussion about if the ban was on flights operating from those countries, then citizens from those countries could travel to another country that we do not place a ban on, and they come in through those countries. They come in through transit. So what exactly was that ban? Was a ban on flights operating from such countries or citizens of those countries? Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. And my first question is for the Minister of Health. So aside the testing for present or absent of viral gene done for patients undergoing COVID-19 treatment in the country, what other biochemical or hematological index do we check to monitor the progress or otherwise of treatment, especially in cases of reinfection in the country? And my next question is for the SGF. So with the recent view of some senators on COVID-19, with the recent view of some senators on COVID-19 response by the PTF as regard to testing and payment of arriving passengers, among others, how do we plan to harmonize different opinions of stakeholders in order to achieve the desired success in the effort to defeat this pandemic in the country. And to the coordinator, so how is the PTF balancing the need to ensure economic growth and the public health situation in managing the reopening of the society, especially with some restrictions still in place while we're reporting fewer cases? For the NCDC rep, what are the reasons for the consistent issue of reagents stock out in some states across the nation, and or some testing centers to say? Do we have a structured logistic and supply chain management totally committed to COVID-19? Thank you very much.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. I would like to direct my question to the national coordinator. So this morning, I got a call from two different individuals, expressing their frustrations of what they went through at the airport. One of the women said she was waiting for her son for about 6 to 8 hours just to complete all the protocols at the airport. And yes, you have mentioned that a lot is being done, a lot of collaboration with CACOVID and relevant stakeholders to improve the NCDC portal. But these guys are still not accessing this portal, which is making them to spend a whole lot of time at the airport. So I want to know what you are doing just to ease off this stress among these passengers. Now, the second question, still staying with you, sir. I want to know the rationale behind having a test 7 to 8 hours before arriving in the country, and the expiration of that test is just 7 days. It can't be extended to about 14 or even 21 days. Looking at the fact that these countries are also having credible testing in those countries. Then another frustration from this woman, she's complaining that the cost of this test is actually expensive. They are charging about 45 to 50,000. So this may just be people who were stranded in this country, who may have exhausted all their fortunes. These are people who may be students who cannot afford it. And coming back to the country where there is increase in electricity tariffs, fuel, and all of that, don't you think this is too much? Can the federal government leverage, can they help to reduce some of this cost, make it even 5,000 naira so that it can be affordable among these people? And also, the woman also told me that most of them, their results were rejected, saying that it is fake. So I want to know, how do you determine a fake result and a genuine one? And finally, still staying with you, the national coordinator, you have mentioned that there are talks with some of these countries. Is there a possibility that they can have a list of credible centers in these countries where they can go have this test, so that when they present the result, we'll know that it's genuine, even in Nigeria? Thank you.
Good evening, Chairman and members of the PTF, honorable ministers, my colleagues. My question is for the Ministers of Health or the NCDC. Some residents of CBN Estate along Zaria Road in Garki here in Abuja are alleging plans by the CBN management to establish a COVID-19 treatment center in the housing estate. And the first question I asked is, does the CBN or any organization have the mandate to solely establish a treatment center without the knowledge of the health authorities? But they insist that the plans are ongoing and they think it will pose health hazards to the residents of the area in their own thinking. And that's why I'm asking, is the Ministry of Health or the NCDC aware of this plan to establish a COVID-19 treatment center? And will it sanction the establishment of such a center, a treatment center in a housing estate? Thank you.
Good evening, the chairman and members of the committee. My name is Agbola Elufowoju, reporting for NTA language. I will first ask my question in English, but later translate it to Yoruba. The question is for the Minister of State for Education. Sir, recently there is a directive that the students of Command Secondary School nationwide should resume for third term of 2019-2020 academic session on Saturday, 19 September 2020. And the session will end by 30th October 2020, just for 5 weeks. And first term of 2020-2021 from 9th November and end by 18 December 2020 for 6 weeks. The parents are now asking that they said they should pay the full fees that they should have paid if they are going to spend like 13 to 14 weeks. They want to know whether this one is that this action is fair. And I want to direct the question to the Minister for Information to answer in Yoruba. Baba, ohun tí àwọn èèyàn ń béèrè ni pé wọ́n ní àwọn ọmọ ilé ẹ̀kọ́ girama tí wọ́n jẹ́ ti ológun káàkiri orílẹ̀-èdè yìí pé kí wọ́n wọlé fún ètò ẹ̀kọ́ ti sáà kẹta ọdún 2019 sí 2020 ní ọjọ́ àbámẹ́ta ọjọ́ 19 oṣù kẹsàn-án ọdún yìí tí ó sì parí ní 20 oṣù kẹwàá. Wọ́n lò ọ̀sẹ̀ 5 péré. Wọ́n tún bẹ̀rẹ̀ sáà kínní ti ọdún 2020 sí 2021 láti ọjọ́ kẹsàn-án tó ní ó sì parí ní ọjọ́ 12 oṣù kejìlá tó jẹ́ pé ọ̀sẹ̀ 6 péré. Ohun táwọn òbí wa ń béèrè ni pé wọ́n ní káwọn ó san owó tó yẹ káwọn ó san tó bá yẹ pé àwọn akẹ́kọ̀ọ́ ó lò ọ̀sẹ̀ 13 sí 14. Wọ́n ní ṣé lè bójú mu bí?
Thank you. We've taken all the questions and we'll be receiving responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the DG NCAA, in that order. After that group, we'll take responses from the Honorable Minister of State Education before the Honorable Minister of Information and Culture comes to the podium. Finally, the chairman will round it up. Honorable Minister of Health, you can approach the podium.
Thank you for the questions. The first question, actually, I will answer partially and deflect the rest to the Honorable Minister of State for Education. And that is with regard to opening of schools. The Ministry of Education has the authority, the final authority, to determine if and when schools open. Working together with state governments, they determine if, when, and how. But the Ministry of Health and its agencies, and as a matter of fact, the PTF also, we have agreed on certain conditions for society generally and for gathering. Now that is that there must be spacing, there must be opportunities for hand washing, for hand sanitizers and masks, and strict discipline in the schools. There are countries that have done that specifically very well. We've seen video clips of countries where the schools have reopened with very strict discipline for distancing, no crowding, washing of hands, spacing even in the classroom and outside the classroom. But generally, it has been noticed that reopening of schools coincided with spikes in COVID cases in other countries, some countries. The advices we have put down are valid. The Ministry of Education will have the prerogative to translate that to the principals, to the schools, to the authorities, and discuss that with the governors of the states who are responsible for state schools. And the Ministry of Health and NCDC and the public health agencies will look on and see that all these are followed. With regard to the memo, so-called memo, there was no memo. Well, children age 5, below 5 are not supposed to be going to school. They're probably going to a nursery. Yes, but they don't go to school yet because school age doesn't begin at that age. But there are places where they say they exempt children from schools, I mean from wearing masks, because the fatality rate among children is extremely low. In fact, in some statistics, they say that the children fatalities among children was 0.3%, which is very, very small. And those children almost certainly must have had some illnesses underlying. But generally, for children under the age of 5, some countries give them, I mean, they won't be going to school, but if they go out in the public, like on a plane, we have seen that some parents give their children masks to wear. But there is no prescription because there's no organized activity for children under the age of 5 outside the homes. So we didn't prioritize that one. But as I said, generally, it is some have recommended there's no need for children under the age of 5 to wear because the risk for them, the risk of falling ill is very, very low. And also probably that they will not be accustomed to it. They may reject it, they may fight it, they may struggle with it. But I have also seen situations where children who definitely were younger than 5 or 5 were tolerated masks. But all of it is informal in that it is not captured in recommendations that we make. Now, with regard to the conversation we had with His Excellency, the Russian ambassador, there was no memo. They did present us, we requested to know about the development of their vaccines, how far they have gone, and what they have done so far. And His Excellency came with an aide-memoire, which is a note explaining how far they have gone and giving us contact information of their scientists, particularly the research center where this development was going on. And we, at the meeting we had with this ambassador, also had our own scientists present and who asked questions. And we're giving the website to contact the scientists at the research center. And that conversation is going on as I speak. I haven't got a report yet, but I also read a few days ago that Russia had promised India, I think, 10 million vaccines, if I remember correctly, from what I read. That because India is among the 20 countries or so who have applied, as at last count, have told Russia that they were interested, and they have been promised 10 million when the vaccines are ready. We are in conversation, and our own is to look at all countries who are producing reliable vaccines that prove to be reliable, and then ways of collaborating with them, obtaining vaccines or manufacturing under license, if possible here, or whatever kind of collaboration that is possible. The federal government has a vaccine company that is just beginning to work, and we are also the chairman of that vaccine company, BioVaccine Nigeria Limited, is where federal government has a share. The chairman was at that conference also that we had with the Russian ambassador. And they're also following up, I'm sure, to find opportunities of collaboration. And I don't rule it out that one day they might be invited to visit to look at how far they have gone and what we can learn from them. For the CBN estate, well, the license to operate the hospital is issued by the state government, and in the case of Abuja here, by the FCT authority that will issue a license. It's not the federal government. We provide the guidelines, and the guidelines have been quite clear that before you operate a treatment center for an infectious disease, you must have the doctors on hand, you must have the nurses on hand, you must have all the equipment on hand, the personal protective equipment and all other equipment, and finally, it must be accredited. So I do believe that there will be an accreditation that will follow before they can operate that facility. And that accreditation will be done by the Federal Capital Territory authorities. And they may also request the Federal Ministry of Health for advice and for support in accrediting institution of that nature. Because there are experts there who will tell you whether it's properly set up and whether it is safe to operate. Now, if I understand Rachel's question correctly, it is what are the symptoms of COVID-19? or what other symptoms go along with it? Maybe you would like to restate that question because we didn't quite get, acoustically, you didn't sound very clear. It is, I think, about, what was your question again, please?
Don't forget.
Apart from the screening. Mm-hmm.
Processes in the country in terms of the infection?
Well, I'm afraid I don't quite get what you're talking about. What other thing we are doing? Well, first of all, on arrival, if you are talking of arrival, what research?
Yes, in terms of infection.
Well, the ministry itself does not do research, but we have a research institute, and that's the Nigerian Institute for Medical Research, and the universities have research institutes also. But I've already said that the Nigerian Institute for Medical Research in Lagos was the first to actually do the sequencing in Africa of the COVID-19 virus when it came here with the index case. And recently, I also heard that the Nigerian Institute of Medical Research is working on cloning the protein that is at the spike of the COVID virus, and that is a step they usually take if you want to use that as an antigen for manufacturing antibodies for COVID-19. So the DG said that they are working on cloning that protein molecule at the spike of the COVID-19. There's also research going on in a facility in Ede, and some universities are working on looking at whatever they can learn more about the COVID virus, particularly the different strains that are said to be emerging. That's all. Thank you.
Thank you. I think I have only one question from Rachel, and that's a constant use of constant stock out of reagent. Let me say that we have a very well-structured logistic supply chain management for all infectious diseases, including COVID. And what we do is we give them stocks of reagents and other supplies on a monthly basis. That is, we give them stocks that will last them for a month, and we follow up the usage, the utilization of this. So in terms of stock out, I do not think we have had any lab with stock out in the past few months, maybe at the initial stage when we started. As we roll out in all other labs, we make sure that we give them enough supply and we monitor the usage, the utilization, and that's well structured. We have a logistics team that's really follow up regularly. In fact, recently we have just supplied all the labs, given them some reagents and other supplies just recently. We've just done that distribution recently. So in terms of stock out, I don't think we have that again. Thank you.
Okay, so I think I have quite a number of questions. Well, I'll leave the single one to the chairman to answer regarding the National Assembly. First of all, the issue of students being asked to pay for tests. The position of the PTF, and this is for students in country, actually. The position of the PTF is not to test students going back to school. It is far more important to be vigilant and to monitor symptoms. And for children where you have families that are infected, making sure that that's picked up early and the children are stopped from going to school. But if you do a PCR test today, the greatest value it has is if it is positive. If it's negative, then that negative result applies to the time the sample was taken. Beyond that, 48, 72 hours, 3 days, 4 days, if you are tested, you can still come up with a positive result. So when it comes to students in school, we encourage schools to be vigilant, to make sure they monitor children that are sick, to take temperatures, to make sure they have access to hand washing facilities in terms of the non-pharmaceutical interventions, and to have a very low threshold for making sure that a child is excluded at the first sign that they might have COVID. In general, children usually do not present with significant symptoms, but they may still have respiratory symptoms, etc. And even in the absence of COVID, a child having a rash or having diarrhea or having a cough ideally should be excluded from school if he's unwell, so that other children do not catch it, even without COVID. And these are the sensible precautions that we will urge schools to take. But it's unnecessary burden on parents, to be honest, for students to be tested for COVID via PCR or whatever test, because it has value only for that material point in time. The issue of fake PCR results, how are we handling this? So this is two ways, really. When you're leaving the country, Nigeria has a responsibility for making sure whatever result is presented when you're leaving the country to another country is valid, is credible. And in that regard, we have provided a list of accredited laboratories to all the airlines. And we would expect that travelers would have results from those laboratories. When it comes to people coming into the country, our staff at the airport, well, first of all, it's one of the reasons why we ask people to upload the COVID-19 PCR result, because it gives enough time for Port Health to also analyze and check and see whether it looks genuine. And rather than fake results, actually, sometimes the problem is that it's an antigen test or an antigen antibody test. So if you're stopped at the airport and somebody says to you, oh, there's a problem here, the likelihood is either it has gone beyond its validity, which we used to have 96 hours pre-boarding, it's now 120 hours or 5 days, or it's not a PCR result. But at face value, looking at a fake result, unless the person faking it is really an amateur, it would be quite difficult to know for certain, is this fake? Now, having said that, we have worked quite closely with some of the countries that we had concerns with. They have given us a list of their accredited laboratories, and we have a much lower threshold for rechecking. But it's more likely we will recheck if on repeat at day 7 you are positive, just to check and go back and see whether there might have been issues. When we started picking up the discrepancies in the negative, those coming in with negative results and subsequently having positive results, that was at a point when we were testing fairly early on arrival. The more you delay testing, the more likely you are to pick up a genuine positive result as a result of the incubation period. So at this point in time, I think as a country we have taken measures to mitigate that risk. We know that there are certain groups of passengers that are more likely to have a conversion from negative to positive. So for instance, deportees, for example, have a higher positivity rate, maybe possibly because of the way they are transported in an enclosed community. You only need 1 or 2 positives, and if they are kept in a single room for days on end, they will just infect each other. But we certainly scrutinize the results, and we make sure that those results are genuine to the limit of what we can identify at the airport. So balancing the needs to reopen society and safety. So yes, we've been going through various phases of relaxation, but it's a balance here. As you know, some countries are already having a second wave. Spain, for instance, is having increasingly a large number of cases a day now. Some parts of the UK, they are closing because of the issues. And that's why we have to be careful. We want to get back to normal, but that getting back to normal has to have a cautious approach. We cannot rush it. If we rush it, we risk going back to where we were before. Yes, our numbers are coming down. Yes, our positivity rate is coming down, but we know that we are still having new infections and we are still having people dying from COVID. And in fact, to our vulnerable populations, the risk of catching COVID now is more present than ever because people are relaxing their guard. People have stopped using masks, have stopped respecting physical distancing, have stopped hand sanitization, etc., on the assumption that this has gone. It hasn't gone away. It's not the majority of the country that has been infected with COVID. There are still a lot of people that are susceptible to it. And particularly if you are vulnerable, if you are above the age of 60, 65, if you have diabetes, hypertension, other comorbidities, now is the time to be even more careful because everybody else is being careless. Now is the time to be more careful when it comes to COVID. So, yes, we have to balance. We have to balance the two. So, frustrations with regards to waiting at the airport. So, I'm surprised any passenger will spend 68 hours at the airport. DG, that shouldn't be happening. If you are unable to pay, you still use the portal and you'll be able to upload your QR code. By the time you upload your QR code, we will have your health questionnaire and we will also have a copy of your COVID-19 PCR result. When you come in country, whether it's Abuja or Lagos, there are people at the airport from the banks that would help you to pay if you are unable to pay. And if you still cannot pay, we will not detain you at the airport. What is the point? If you cannot pay, you cannot pay, whether you're staying there for 5 hours or 10 hours, in which case you will be allowed to go home, and we have put in place processes that allow you to go into a bank to pay. So you don't need to stay at the airport for a prolonged period of time. And we've already got your details anyway. If you do not do the test at day 7, by day 14 we'll pick you up. And if you would rather have your passport have restrictions than having the PCR test by day 7, then. But certainly we do have ways of enforcing this. And that's why we are no longer taking passports off travelers at the airports. We allow people to go with their passports. No problem. We don't need the passport in order to put restrictions on it if you do not do the test at day 7, and by day 14 we can enforce it. Yes, so that's unfortunate for the passenger. We would like to know more about the details so that we can find out what truly happened. But no passenger should be staying hours at the airport. At best, if you do not have the documentation, if you don't have the QR code, yes, you will definitely have a delay. And that's why we're insisting that if get the QR code, because you can get the QR code even without paying, but we prefer you to pay and have everything complete. If you have that, it's a